I'm Dan Mroczek. I am at Northwestern University in both the medical school and in the Arts and Sciences College. I'm a professor of psychology in Arts and Sciences, and I'm also a professor of medical social sciences in the Feinberg School of Medicine. So I have a dual appointment here at Northwestern. I study how individual differences in psychological characteristics, especially personality traits, influence health and longevity, but other important life outcomes. Mainly interested in how personality traits influence various kinds of health variables, patient outcomes, hospital outcomes, certainly mortality risk, disease onset, and other things that are related to general area of health, like for example, medication adherence, physician adherence, and so on. I work a lot with physicians down at Northwestern Medical School, looking at patient outcomes and other types of outcomes and metrics that are of great interest to not only physicians, but also hospital administrators and also other stakeholders like health insurance companies, Medicare, other stakeholders like that. These include things like rehospitalizations, returns to the emergency room. So these are metrics that are of great importance. You don't want people, when they've been released from a hospital, to kind of bounce back. Sometimes they bounce back for reasons of, that are more economic in nature, socioeconomic status and so on. But it turns out that this thing that I study, personality traits, is related to all these health outcomes as well, and hospital outcomes in addition. So for example, how self-controlled you are, how self-disciplined you are, this influences your health behaviors and in turn health outcomes, patient outcomes, and hospital outcomes. But it's not just things like self-control. There's other personality dimensions that are influential. For example, to the extent to which you feel anxiety, to the extent to which you feel in control of your life. So there's the extent to which you have good interpersonal ability. If you have good interpersonal ability, if you're extroverted and if you're agreeable and you have good interpersonal relationships, oftentimes that affects your health in very, very positive ways. You can kind of marshal the resources of your family and your friends, to get you to the hospital or to help you carry out a treatment plan, like post-surgically or something like that. So it's, so there's lots of ways in which these fundamental psychological characteristics that we call personality traits influence our health and indeed our longevity. This area kind of started when it was discovered more than 20 years ago that personality traits influence how long we live. And so it's now known that several personality traits influence longevity and how long we actually live. So that's the main area of research that I'm focused on. It has obvious ramifications for human capital because a healthy workforce is a productive workforce. There's a lot of interest among companies these days in employee wellness and workplace initiatives, occupational health, workplace initiatives to keep your workforce healthy, and so it has real intersections with business and economics. But at the same time, it's also just very relevant for a lot of issues that are going on in the United States right now, the Affordable Care Act, and how do we make healthcare more efficient, how do we get healthcare costs down. A lot of waste in the healthcare system is due to individuals that don't adhere to their healthcare plan. They could be prescribed a medication, but due to the kind of person that they are, due to their personality, they don't get the prescription filled, or they might get it filled, or it's given to them and they don't take their medication, and that causes health problems down the road. Some people are more likely to keep their doctor appointments. Other people are less likely, due to their personality traits, to keep their doctor appointments or get that mammogram or get their prostate check or get their colonoscopy. That's another one that people just avoid doing, and some of that is due to people's psychological characteristics, especially their personality traits. That's the main area in which I work, and it has I believe it has great ramifications for the area of human capital.